from the News Channel 5 network. This is Titans Tuesday.
Oh, it must be Titans Tuesday, everybody. I'm Hope Hines. Happy to have you in on this very cool Tuesday evening. We have two outstanding Middle Tennessee, let's say we have two outstanding American doctors in our midst here tonight. I want to introduce to you here in a little bit. I'll call their names now, Dr. John Jasko and Dr. Damon Petty. Dr. Jasko, thanks for being here. John Jasko, we appreciate you being here, sir.
Thank you. Thanks
and
for having
Dr.
us.
Damon Petty, you're just kind of old hat here, aren't you?
Yes, sir.
Happy to have you back.
Thank you.
So, guys, you both deal with broken bones and that sort of thing. We were talking earlier before we came on the show. I've had doctors on every week, Damon, as you know. Titans just haven't had any real problems in that area, so I guess that's good for the Titans. But as far as our conversation up here on Tuesday nights, we just kind of have to run the gamut and talk about a lot of things. So I said, why don't we talk about the problem that Kyle Vanden Bosch has, which is the most prominent injury right now, and that is I guess the proper term, John, is a pulled groin. What is a pulled groin?
Pulled groin. Well, talking about the muscles in the groin area, and the technical term is the adductor muscles that pull the leg in, and certainly they're under a lot of stress with.
Is that the
movements.
Inside of the?
Inside of the thigh.
Okay.
Right,
okay.
right. And so just like any other muscle, you can get it stretched beyond its capacity, or actually even torn off its attachment of bone, and that can result in the injury. Similar.
So, Damon, does that occur when maybe you're not properly stretched?
I think that can contribute to it. I think another thing we've seen that contributes to groin injuries is preseason conditioning and the amount of strength building you've done in the groin muscles prior to the beginning of the season.
Okay, so both of those, any of those things, all of those things, and sometimes maybe even none of those things. It just happens.
Right.
Does it happen to the non-athlete? I mean, you've got to be out doing something to pull a groin. I mean, you can't be sitting around watching TV, I wouldn't think, right?
Well, it's true. It's not going to happen watching TV, but it can happen to the.
Could you be doing yard work?
Can be doing yard work. It usually will be a twisting injury or a quick lateral movement, and certainly you can pull muscles, and especially if you're a weekend warrior or not conditioned at all, you'll be a lot more susceptible in those conditions.
Okay, all right, then I can certainly understand that. But you guys don't treat it, you don't deal that much with it. Who would that kind of doctor be? Groin muscle.
Oh, it's still a sports medicine doctor.
Okay,
sure.
okay, sportsman. Okay, very good.
The trainers certainly and the therapists are key in rehabilitating those injuries, because fortunately most of them don't need surgery.
We just talked a moment ago about Jason Witten, who has a broken rib, cracked rib, and he's going to play. How do you do that? There's not much you can do for a rib that's injured anyway, because you can't put it in a cast. You just kind of tape the individual up. Is that right? Right.
You can't constrict it too much, because every time you take a breath, you're moving that rib, and you don't want to constrict the lung capacity, because of course you need that for breathing. So either the individual is extremely tough, they may take some oral pain medicine before the game, such as an ibuprofen type medicine to get them through.
Yeah. So, any guys, Damon, probably wouldn't see that many either, would you?
I was thinking in the car on the way out here, I heard they were thinking about playing him, and I was thinking, how's he going to do that?
Yeah, really.
You'd have to get real creative, maybe inject it or something like that, which leads to the possibility of even bigger injury if you go that far. So
when you inject somebody, guys, what are you putting in them?
In that case, it's mostly just a lidocaine or a Mark. It's an anesthetic. Same if you're getting your teeth worked on and they numb up your gums.
So you just don't feel anything.
You don't feel that particular area.
Exactly.
Right?
So you can go out and you can just hammer somebody and you never even know what happened. Same thing with ankles and things like that. I mean, I know even back when I played, they would come a guy said, "Hey, you need to shoot you up." Oh, fine, let's go. Here we go. But you're right. You can injure yourself even more because you just don't feel it, do you?
I think you're right, and I think. In years past, everybody has heard the allegory of the pro football player who had his knee injected so many times, now he's got bad arthritis. And, I think that's...
So that's what does it then? It's the injections as much as the injury itself?
I think the injury itself is as much a party to the arthritis developing, but I really do believe that repeated corticosteroid or cortisone injections into a sore knee can contribute to a more rapid progression of arthritic change.
But if you're a guy like Tony Brown, and you get a little injury, and you got to play, and somebody's waiting to take your job, and you're young as he is, you don't worry about what's going to happen 15, 20 years down the road, do you? You take those injections. You do it.
If they're offered to you, you might.
You got to. I mean, you do. I know. Right, Tony? Yeah, exactly. Yeah, he'll talk about it in a minute. Yeah. In any event, we have some concussions, as we always do, and some of the players. That's kind of almost across the league, even a weekly experience from one Sunday to another. And when one sustains a concussion, what's happening? What does that mean?
Well, a concussion is also known as a mild traumatic brain injury. So the player gets hit such that the brain actually moves around in the skull. Okay. The brain's in bathed in some fluid in the skull and is attached to the skull. And so if it's hit and it changes direction, you have a shearing force. It actually changes the way the nerves in the brain function. So you have a change in their ability to think. You may lose consciousness or get knocked out, and you may feel foggy, lose memory. And so that's what happens in a concussion. And it's more of a functional problem than something you can see on an X-ray or an MRI or an imaging study. And
Damon, how do you treat that? Just time off, right?
I think the most important thing is not getting a second concussion too soon after the first one.
That would be good.
Yeah. And it's time off. It takes time for the brain to re-equilibrate, for the metabolism of the brain to go back to normal. What we've seen with concussions is the brain actually burns more fuel than normal, and it cannot.
You mean when it's under concussion?
Yes, and it cannot expel the waste products as easily. So you got a dangerous situation where it's eating a lot and it can't expel the waste products, and it becomes more vulnerable during that period of time and functions less well.
And over, Frank Wycheck, and I don't mean to just point him out, but Frank Wycheck, that was one of the contributing factors to his his retirement in any event. He's not the only one. There have been a lot of other guys that have retired. NASCAR drivers, they get in wrecks and they have those big helmets for so do players, but you're banging around in there and you still injure yourself and hurt yourself, and you have too many concussions. But I understand, doctors, that over the last maybe 10 years, some really revolutionary things are being done because of that. And the NFL is taking a real hard look at this because they want more information. They want to be able to treat this in the way in which it should be treated.
Properly, yeah, they're looking at the long-term consequences of concussions, and some of that information is coming out, unfortunately, from previous players who have had problems, and so they want to protect the player now, and we're being much more cautious, and not just the professional athlete, but athletes all down the board in trying to protect them from having the long-term damage.
Dr. Petty, I ask, in your work, do you guys with broken bones, do you have to use plastic surgery sometimes? Do people require that with things that happen to their body? Now you guys don't deal with the facial area, I understand that, but anything is fair game below the neck, right?
Pretty much. It's a rare injury that requires the assistance of the plastic surgeon to treat it, and I've had him help me in my practice a few times with devastating fractures of the lower extremities where the muscle and skin has been stripped away to the point where you have to move new muscle and new skin to cover that area.
Wow.
And we've used them a few times to transfer tissue into the shoulder to fix rotator cuff tears that were otherwise unfixable. But other than that, not a lot of time with them.
Yeah, I guess. John, I was talking to you a little earlier about bones that are just fragmented and splintered. That's pretty messy, isn't it? I mean, you guys have to do some messy stuff, but you do great work. So on the other end is is your reward.
Yeah, exactly. And you just have to take whatever injury comes in and deal with it the best. Unfortunately, we have a lot of good biomechanical people that have given us good implants to use that fix bones and get them stable while they heal.
Doctors, I want to thank you for your time once again. Thanks for being here. Dr. Damon Petty, this is your second time around. We paid you twice as much this time as you did before. John Jasko, and they both are here tonight as part of the Baptist Sports Medicine time of our Titans on Tuesday. Thank you guys for being here.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me.
Life isn't a spectator sport, so jump back in. Visit sths.com.